Hello guys, welcome to Vibe Zero Talk Show, Talk Yetu, Show Yetu, and we are very glad today to have our guest here who have taken the attempt to come to Vibe Zero Talk Show. And my name is Justo, a host at Vibe Zero Talk Show, and this is Talk Yetu, Show Yetu. Now before tuendelee sana, maybe I'll give my guest opportunity just to tell us who they are, because this is a rare opportunity. So let me start with you here.
Thank you, viewers. I'm Eric Seda. I'm the current National President of the Kenya Pharmaceutical Association. Thank you for hosting us.
Thank you very much.
Thank you, members of the public. I'm Steve Oyaya, member of Kenya Pharmaceutical Association. I'm the current member of the board of management, Pharmacy Apostles Board, and also a member of the board of trustees of Kenya Pharmaceutical Association. Thank you.
Asanteni sana. Leo niko na the president of madawa. Yaani huyu jamaa ndio rais ya watu ambao wanatumia dawa, si dawa mbaya but dawa ambayo inatibu watu. So we are very glad by the Mr. Seda for finding opportunity to come and share with us what is pharmacy and what it entails. So maybe I'll start with you, Mr. President. Maybe you can just tell the general public what KPA is, and you are the president of what, so that people can also know that.
Thank you once more. To the members of the public, we are glad that you are part and parcel of this interview, which we hope will be very helpful to the general public. And thank you also once again for hosting us. Kenya Pharmaceutical Association is a professional body that is registered and recognized in Kenya by law and by registration. And it entails about the management, and also it looks into the practice of pharmacy in the whole Republic of Kenya. It's a professional body, and it has got a membership of over 12,000 members who practice in different parts of Kenya, and also at different levels, and also in different sectors. So we interact mostly with patients, for those who are working in the community pharmacies, and also those who are working in the hospitals. And this is something that I know moving forward in our discussion, we will bring much so that members of the public can understand our role, our scope, and how important this sector is. Thank you very much.
Thank you very much, Mr. President. Tunasema ni asante sana. Najua umesema kwa Kizungu na najua kuna translation ambayo pia wataelewa kwa Kiswahili na lugha zingine, sababu pia kuna wengi sana ambao wanatazama, na tunashukuru sana kwa kupata opportunity. Maybe Oyaya, you work with the Pharmacy and Poisons Board. You are also a member of Kenya Pharmaceutical Association. Maybe you can tell us more about how do they work together.
Thank you so much for that very important question. The Kenya Pharmaceutical Association is the professional body that upholds the standards of practice among professionals. PPB, that's Pharmacy and Poisons Board, is the regulator that sets policy and control the practice. Yeah, it regulates the practice by setting policies that will also transcend to the service of general public. So they work hand in hand, one upholding the practice, the other one is regulating the practice. Thank you so much.
Mojua pale kwa community, watu wakisikia watu wa board, wachana na the practitioners, wakisikia tu watu wa board wanasikianga ni watu wa aina gani? Wengine wanakuwa scared. Hebu waambie community watu wa board kwa lugha ambayo maybe wanaweza elewa.
Thank you, asante sana. Watu wa board kazi yao ni protect the interest of the public by ensuring that the right medication is in the market and the right personnel are handling the same drugs to ensure that the public is safe from harm from the medication. So mkiwaona around, they are there for your own interest, not to harass anybody, but just to ensure that everybody is safe. If you see them arresting people, mostly they arrest watu wenye hawaja qualify kufanya hiyo kazi, and always done in the interest of the public and not for any harm. So if you see somebody running away from the people of the board, no, hao wako na shida na nyinyi watu wa public. Asante.
Asante sana. Ameelaborate vizuri sana. Amesema ya kwamba what they are just trying to do is to ensure that we have the right medication to the right patient, the right dosage, yani kila kitu kwetu sawa. Hiyo ndio maana board ina exist. So msiogope, mkiona mnajua wanakuja kuwasaidia, au sio? So to Mr. Seda, you know, community, and there is a lot of misuse of medication just over the counter. Actually, we were celebrating, I think, the anti-malarial week. It is ending this week, isn't it? What can you tell people about the importance of taking the right antibiotic or other medication the right way so that can help them?
Thank you. Just before we go into that, maybe I would want also to jump into what my brothers just said about the board and the fear that comes with the name of the Pharmacy and Poisons Board. Sitakubaliana na yeye sana kwa maana wakikuja pale kwa community pharmacies, wamekuja na mapolisi, and you know Kenyans with the police, yes. Maybe if they look into that, yes. Otherwise when they come with the police and all those, people will continue to have that fear. So I think that's one area that they should be looking into, so that they make the inspections look more professional and accommodative. We know Kenyans with police. When you see a policeman, the first thing is to ask yourself, what did you do wrong? But that is a story for another day. Maybe let me just jump into what you've just asked about the perception, first, of the community members on the use of drugs. I want to categorically say that it is research that has shown that, like in Kenya, almost 80% of Kenyans would first seek their care from community pharmacies. That means that before somebody goes to the mainstream facilities, be it public or private, they must visit the nearest pharmacies. So our members play a very integral part, or a very important role in ensuring that our community members receive safe and quality medication. That should be our first priority, and that is what we do with our members. But besides that, you said that there is a lot of misuse of drugs. That I would not say that that is wrong, but to the extent that we put some caution, because not only us, our members practice, we have got also other people who are not trained, who are also practicing in the community. They are unregulated lot, and there are many, by the way. And if you look at the number of community pharmacies against the ones that are registered, you realize that the ratio is quite alarming, where you find that only 15,000 plus are registered community pharmacies against about 24,000 community pharmacies which are unregulated, meaning the members are not properly trained to handle drugs. So we would say, or I would attribute this to many factors that are in play, not only the issue of the unregulated practitioners, but also the general cascade from the point a patient receives the prescription to the last point he gets the medication, and how this patient takes it. So we have got also other players in this sector who should also take this seriously by ensuring that they write the right prescription for the right medication. What I'm saying is that if we get a wrong medication for a wrong disease or a wrong indication, then you get it wrong all the way. So we have to look at and to bring all players into the picture and ensure that every person, every professional does his or her work. As a profession, we are really working to ensure that we only give the right medication for the right condition. That is, prescribed medicines are given to patients, and drugs that are controlled are given as per the schedules that are put in place in the guidelines. So on unsafe or irrational use of drugs, where everyone goes for drugs and they keep the drugs in their houses, this is something that should be looked into, because it has got a net effect in the general well-being of the patients, and also it is a public health concern because of what we are now having, the antimicrobial resistance. So it's something that should be looked into, and we are looking forward to having all stakeholders on a table so that you can discuss this matter. From the regulator's point, association, professional bodies, to the community, to other health actors, so that this issue should be tackled. Thank you.
Thank you very much. Nadhani umeelaborate vizuri sana for the people to understand how your role plays in terms of having the right medication and also the right usage. But then, for instance, there is sometimes I saw a prescription, not really a prescription, but an envelope, whereby I don't know whether it comes from our members. They just write 1 times 2 without writing the name of the medication, which I don't know what the board or the KPA is. You can say about it. What can you say about that?
When it comes to that kind, that's I think is not the right thing to be done. And if you get a professional doing that, I think that is gross. And it's part of the training that we go through, which I think for the professionals, they are properly trained to do the right thing. But just as the president has said, that we are in a field that is dogged with a lot of people who are not qualified to practice. That could be a case at hand. And that therefore calls for very stringent measures. One thing I know, for the rational drug use, it will take an effort from different stakeholders, just as the way he has said. I know there's a role that the regulator has to do, which we definitely are planning to do the best we can. There's the role for the professional bodies to do, to show that their members are always updated through the CPD provision, that they're trained properly, continuous training, yeah? So that development, so that they can be able to be updated on the new trends in the market. And then now there is also the advocacy bit of it, the media and the campaign against the irrational drug use. The public and our health-seeking behavior is strange, that we are not well educated about all this, and the media is quiet about it. I think the media should now take it up because it's becoming a crisis. Then again, we are in a country where people first go to the pharmacy, whether manned by the right professional or not. And who unto them, when they get to a wrong hand in the first case, then that marks the beginning of all problems. So it's a big, big challenge. First is to clean the practice. That will now take all of us, with the regulator leading the battle. Already we've done some bits, but a lot still remains to be done, and we'll do it more. Yeah.
Having said that, so maybe if general public who is watching this interview, how can he reach you? What are the avenue where this community or somebody in the community, he get this kind of prescription, a wrong prescription or a wrong indication, and he want maybe to report to you? How can he reach you?
We've got the inspectorates on the ground in every region. So always in every region there's the headquarter, and then always there's contact. Even the pharmacies, they know then the contact with the inspectors in the particular regions. Let's say in Coast, we've got the regional head here, and we also have got inspectors on the ground. They are always our first point of contact. That because that's also their job, they do 24 hours a day. So when they get something like that, they first handle it at their level before it is calculated to the board up there. So we would advise that anytime they get such kind of challenges, they can go to any pharmacy. There are codes in the pharmacies just to confirm where the pharmacy is registered or not. And obviously there'll be a professional inside there. So through the professional, they can always get the contacts of these inspectors in any region. Thank you.
Thank you very much. I want just to move to maybe a second last question to you. We are moving in the technology. I don't know, our theme for today's conference was about safe and technology, isn't it? And now that you said technology, we've seen a lot of people, they use this Dr. Google. What will you say about somebody just look at medication and Google and angalia diclofenac can treat this headache, kama inaweza treat something like that. What will you say about that, Dr. Google, about Dr. Google?
Thank you very much. I think that is a very interesting point that we need to address, and also to help our public to make very serious decisions, that it is not right to Google your condition, or okay, for your information, you can Google and get any information from internet, but those pieces of information are not authenticated. everyone throws anything, so you are not sure whether that information you're having is the right information. I know there are sites which give authentic information, but not specifically on medication. And even those very authentic sites, what they would say is that please visit, if you see all these, visit your nearest health facility or your doctor. That is a very authentic information that anyone can get. But if you see somebody gives you a prescription or give you a list of drugs to buy, or I want to tell our public that they should not rely on Mr. Google or Dr. Google. The way this doctor is not real. He doesn't understand your body processes. He will just give you what you want. So garbage in, garbage out. So whatever you give, it will give you anything which you cannot rely on. And I think this is why most of our members of the public, some of them will come to our pharmacies and say, I want antibiotic, this or that. You ask the source, I was told by a friend, only to realize that that was Dr. Google. So this is a stern appeal to our members of the public that when they have any problem, they should seek services from professionals. They can walk into pharmacies manned by professionals, or they can go to health facilities, both public and private, to get authenticated information. With this, we will avoid irrational use of drugs and also misuse or wrong usage of drugs. And this will help us in the management of our conditions. Maybe on the other thing, I would also emphasize on what my brother Steve has just said, that on how to identify or how the public can reach us as professionals. We are coming up with standards which we'll share with the public on how they can get access to information in those regulated or registered premises. And even if you walk to a chemist, even in town or in the village, one thing that is conspicuous that the board has really tried to do is to make sure that we have got safe codes where you can just, it's a toll free, you can just SMS and you'll give the details of the pharmacy, and you'll get this pharmacy is manned by a qualified person. But even if it's not there, you can just look, you'll see the license conspicuously placed, you'll see practice license, and you could just ask, are you a professional? And it's good to know who is serving you, the confidence that person comes with. And you will see the way the pharmacy is, the outlay. You can now know that this place, and if you're not sure, just ask. Because if you ask, you will know. So we urge our members of the public not to rely on authenticated information from Dr. Google. Today we are saying no to Dr. Google. We want real doctors. Thank you.
Sure. Also, maybe to add, Dr. Google doesn't take responsibility for anything that happens. So when you consulted him and he gave you wrong medication and you take, then you can't take Dr. Google to court. So again, there are people who have consulted him and ended up so badly than the way they were, because you Googled conditions that gave you very serious conditions about you, which doesn't even exist. Then you went down there and started saying now you have cancer. It has happened, by the way. I've seen people. Then finally, when they seek now opinions from the real experts, then they realize they are safe. Yeah, they are safe. So it's not really the best way to go. And maybe if you want to join the rest in the other field where people are not so happy, then you can consult Dr. Google. Thank you.
Utakuwa na mental problem because of Dr. Google. So guys, we are coming to the end of our show, and maybe I'll just hand over the microphone back to you. Where do you want to see the pharmaceutical industry maybe the next 5 years in Kenya?
My wish and prayer is that we have a very streamlined practice where we have got the right people serving the public in their respective areas of expertise. We want to ensure that there is safety in medication, where when you walk into a pharmacy, you get the right person there serving you. We also wish that we finally get into manufacturing as a country, so that we can also manufacture our own drugs, so that should we be hit by a pandemic like we did in COVID, we don't run short of drugs because maybe there were issues in the other side of the world. So to the public from the ruins of the microbial resistance, which is coming, I think it's a global pandemic. Yeah. So for us to save ourselves, we will have to also to get members of the public properly educated about the dangers of what's happening at the moment. Thank you.
Mr. President, I know your members are really watching and they want a word from you. What do you have for them?
Thank you. Even as we come to the close of this interview, I would want to urge our members to maintain the highest standards of practice to the general public, and how I wished that we have enhanced workforce in this sector so that our members of the public are served with properly trained and qualified professionals, so that the Kenyan people can get the best healthcare. And this is what is stated in our Constitution 2010, the highest attainable quality healthcare. That is our desire, and I hope they are up to the task to ensure that this happens. And maybe as my closing shot, I would say that one thing that Kenyans should take seriously is pharmaceutical care. Everyone knows that you cannot ride on a deflated tire of a bicycle or a motorbike. It is only in a pharmaceutical field where somebody will take a drug that he doesn't know what that drug will do for him or her. So I would urge the public to take drugs only when prescribed by a professional. Not going to the pharmacy to just go and pick drugs and keep them. No, please take drugs that are prescribed by a duly qualified professional, dispensed by a duly qualified pharmaceutical technologist or pharmacist. If we maintain all this, we will get better health outcomes. Thank you very much.
Guys, thank you very much. Well elaborated, well informative, well educative, and we've just heard from the president, from Steve Oyaya, from PPB, and the president of Kenya Pharmaceutical Association, urging us to use medication in the right way, the right dosage, the right indication, because kucheza na dawa vibaya inaweza ikakuumiza. So just make the right decision. When you are feeling kind of headache, or you are feeling your body is not in the right condition, visit your doctor. Then the doctor will prescribe the right medication, because if you just use medication without knowing really what is happening in your body, it will endanger your life and it will even bring more problem. So it was my pleasure, guys, for coming to Vibe Zero Talk Show, for positive vibes that you want to see in the community. And I know the message is home, and those people are watching, they are going to listen to this video and they are going to get educated. So thank you very much. Asanteni sana. Hope to see you next time. Thank you. Bye. See you. Bye.